The Aboriginal community control is informed by the Aboriginal community, so it's absolutely owned by our community. When the communities say they need something, we respond. So as a Health Services Director, I work very closely with our Senior Medical Officer. We also have very close relationships and partnerships with allied health directors, so people that are in charge of our allied health workforce that deliver services within our clinics. Social health, so mental health and wellbeing professionals who deliver psychology, counselling, family wellbeing type programs that walk alongside our families. So we also deal with a lot of child protection bodies because that also feeds into health as well as domestic violence health professionals, people that specialise in that area. And we also have aged care health professionals because we have a residential aged care facility that we're in charge of.
Nationally, Aboriginal health workers in the Northern Territory were the first to be professionally registered and the first to develop a professional association in the year 2000. On the 1st of July 2012, like other health professionals, Aboriginal and Torres Strait Islander health workers were provided the opportunity to become nationally recognised under the National Registration and Accreditation Scheme for Health Professions.
The difference between an Aboriginal health worker and an Aboriginal health practitioner is the practitioner is registered under the AHPRA, the National Act. An Aboriginal health worker isn't. An Aboriginal health worker is responsible to a nurse for anything they do. An Aboriginal health practitioner can do things themselves.
The Aboriginal and Torres Strait Islander health practitioner may be found working in a variety of primary healthcare environments, such as Aboriginal community-controlled health organisations or in the public health system. Aboriginal and Torres Strait Islander health practitioners are the experts in First Peoples knowledges and comprehensive primary health care, therefore critical to ensuring culturally safe healthcare.
So we bring cultural knowledge, we bring community knowledge, and they're the two key factors that contribute to improving our people's health. We don't just look at the clinical component of a situation, we look at what are the contributing cultural and community factors that could add to this person's illness. And we maintain the philosophy of our services, and that's community control, and that's my vision. And you know, it's not easy, it's not easy, but that's what, you know, evidence shows, research shows that if we maintain culture as the central to improving our health, that it will work, and that's the vision that I see for our people and our services. My advice to non-Indigenous health professionals is know what Aboriginal health professionals are out there. So you will know that we've got health workers, we've got health practitioners, we've now got registered nurses, we've got care coordinators. We've got all of these professionals out there.
Any non-Indigenous health professionals out there who are wondering why we need this type of a service, I can say from personal experience that I used to travel past 20, 30 medical services, GP services to get to my Aboriginal medical service, because that's where I felt like I belonged. So that's why these places exist. And if you're so inclined that you want to come and contribute to the better health of First Nations people of Australia, I think this is the place to work. You know, of course, Aboriginal people access lots of other things, but they access an Aboriginal medical service in a very, very different way. You get a very, very different experience and a very, very different way to use your skill as a health professional if you work in a place like an Aboriginal medical service.